Endometriosis, maybe how I can start is maybe give a background of the female reproductive system. So we have the uterus, which we also call the womb, that has 3 layers. It has an outer layer, it has the muscle layer, and then it has the inner layer. The inner layer is the one that usually sheds during menstruation, and that is what we call the endometrium. So endometriosis is basically presence of this endometrial tissue in other sites in the body other than in the uterus. The cause of endometriosis is largely unknown, but there are several theories that are there that maybe have been speculated how endometriosis comes about. One of them is that instead of the menstrual flow going through the normal way, through the birth canal, it finds itself in other sites rather than within the uterine cavity. And when this endometrial tissue moves to other areas, it causes irritation of those tissue sites and leads to inflammation, and that's what later makes the patient develop the symptoms of endometriosis. We do not necessarily have types, but what we have are stages, and stages range from mild or minimal endometriosis up to severe, where stage 1 and 2 is minimal to mild, whereas stage 3 and 4 is moderate disease to severe disease. Most patients who have endometriosis present with pain in the lower abdomen, and this pain may increase in severity during menstruation. Sometimes the patient may present with blood in the urine or blood in the stool, sometimes discomfort during coitus, which is sexual intercourse, and sometimes the patient may not have pain symptoms, but they may come in with difficulty in conceiving for a period of time. Those are the main symptoms. However, because this endometrial tissue may go to other sites, for example, the chest, the patient may present with bleeding in the chest. Sometimes they may have severe chest pain, and most of the symptoms of endometriosis, the patient notes they are cyclical. That means regardless of where the discomfort is coming in from, maybe the chest or the abdomen, the patient realizes that these symptoms are associated to when they're actually having the monthly period. The treatment options are diverse, and it's not all size fits all. So treatment depends on the kind of patient that one has, because endometriotic symptoms can start from adolescent until menopause. And with the main symptom being pain, what we try and do is alleviate the patient's discomfort by providing the patient with painkillers. There are also other options that are medical related, that is, for example, providing hormonal medication just to reduce the symptoms. And the mainstay for endometriosis management is surgical management, where we actually go in and remove the endometriotic tissue wherever it may be, and that in most cases gives the patient relief from their symptoms. For any form of medication or any form of treatment that a patient receives, we have to weigh the benefits versus the risk, and some of them is we need to empower a patient on what kind of treatment is available for what they are going through, and what the doctor would advise, and even get the patient's opinion as far as how it is concerned. For example, patients would not be very willing to have surgery done on an adolescent because of the likelihood of maybe surgical issues coming up, and the patient may be requiring multiple surgeries as the patient grows older. So basically it's more of weighing the benefits versus the risk, and for each individual patient. Endometriosis affects about 1 in every 10 women. And in the women having endometriosis, the issues of conception, issues of getting children affect about 30 to 50% of them. Some patients may not be having symptoms of the endometriosis, but they're still able to conceive, and it becomes just an incidental finding that they have endometriosis. But for each patient, what we physicians do is have something called an endometriosis fertility index. And what this entails is gauging the kind of patient that one has. Is it, which include historical factors like the age of the patient, how long the patient has been trying to conceive, any other treatment options that the patient has gotten. And then we also check the status of the reproductive organs after surgery. How are the fallopian tubes? How are the ovaries? And that gives us a basis of ascertaining what is the likelihood of this patient conceiving after surgery, after putting it all together. So endometriosis is basically cells from the inner lining of the uterus being found in other sites rather than in the inner lining of the uterus, whereas fibroids are abnormal growths within the uterine tissue, and they can originate from any layer of the uterus. That is the main difference. However, patients may present with similar symptoms of abnormal uterine bleeding and in some cases even pain. Because the cause is largely unknown, just like any other disease, it would be to encourage a patient to try and live a more healthy lifestyle, that is, avoid smoking and alcohol, and basically involve doing also exercise. So it is not something specific tailored to reducing or preventing the patient from having endometriosis. What I would really like to bring for the community to know is to be aware of the condition endometriosis and how it affects productivity for the patient, and also for once the community has an understanding of what endometriosis is, then they're able to provide support to those ones suffering from the condition, and in addition be able to set up policies, or the policies to have a basis of policies standing for what do we do for these patients who are not able to attend to work because of the symptoms of endometriosis. And also in addition, when we create awareness about endometriosis, patients are able to seek help early. And as I wind up, I would like to say that pain during menstruation is not normal, and there is need for patients to be evaluated for us to ascertain what kind of pain they have and how to best manage it.